All right, parents, listen up. The FDA warning, teething medicines are unsafe and they want them off the shelves. Dr. Richard Chaffoo is here with more. This is a big deal.
It is, Shally.
A lot of parents rely on this when the kids go through this.
Yes, they do. And, you know, the FDA, as you said, stepped in and said, you know, a lot of these medications that parents have been using that were over the counter actually contain a local anesthetic called benzocaine, which has been implicated in something called methemoglobinemia, which is a serious disorder where there's actually, it affects the protein that transports oxygen in our red blood cells. And so this can occur with these topical agents because, as you can imagine, the oral cavity has many blood vessels in it. Large topical applications of these will cause all kinds of symptoms that can be life-threatening.
Why now? Because these products have been on the market, I feel like, for a while, and I know that recently there are some of these even natural homeopathic ones that I think were in the news where they said stop using these.
Yes, exactly. And unfortunately, Shally, even the homeopathic remedies are really not regulated by the FDA because they're not considered drugs per se, but you're right. And I think the reason why the FDA has stepped in at this point was we're actually seeing more and more cases reported of serious illnesses and unfortunately deaths, seizures can occur. So there's some serious side effects from these treatments.
Is the concern, Dr. Chaffoo, just for the little babies that are teething, or is it, I mean, because sometimes you get 5-, 6-year-olds and their molars are coming, like all their other teeth are coming in?
So it's certainly, you know, within the pediatric population, the American Academy of Pediatrics has come out with a policy statement saying really to stay away from these. There are simple remedies, you know, the teething rings, which parents use, and they're quite safe. You don't want to put those in a freezer, of course, because if they bite down, they can injure their gums.
I didn't use anything with my third child this time, and she just kind of fought through it, and I said, you know what? That's life,
part
sweetheart,
of life, right?
You're like, things are going to hurt sometimes, and you just got to power right through it. Okay, speaking of hurting, I don't have my cell phone around me. Maybe I should, this is a good thing, because you actually want to put down your cell phone.
You do. You know, it's amazing. I was driving my kids to school this morning, my 16-year-old, I think she's a budding dermatologist. I said, well, now we're doing a segment on, you know, cell phones and damage to the skin. And she began to rattle off, you know, the different factors that are associated with, you know, I know dangerous injury to the skin related to cell phones.
So what is the cell phone doing? I spend a lot of time and a lot of money trying to like keep the skin young.
Yes, so the cell phone, you know, one of the big things, Shally, is simply spending a lot of time looking at a phone or looking down. You know, this is called the tech neck, where we're getting more wrinkles in the neck. We're squinting at the screen, which gives you more of the crow's feet, the little lines around the eyes. And also, if you're putting the phone up against your skin, the heat of that can actually cause some age spots or brown spots just from the, can damage the melanosomes from the heat of that, yes.
What about acne?
Well, you know, my daughter mentioned the same thing. She said, oh, Dad, you know, if there's actually more bacteria on the surface of your phone than on a toilet seat cover. So certainly we want it's amazing. Just because you imagine the numbers of times a day it's handled by many people, it's put down a lot of surfaces where there are a lot of bacteria. So you want to really keep those clean and wipe those with like a wipey or something else, an alcohol product.
Okay, what about the wrinkles?
And the wrinkles, of course,
I mean, you get it over here. I
have get it in the neck area.
Cell phone neck, whatever it is.
Exactly, but we're also looking at these screens. We're squinting. Sometimes the text is small, the print is tiny. We're also looking at these screens oftentimes at night, glaring at these, and that can cause problems with dark circles, lack of sleep at night. So
I don't know what to do now.
I know.
We need our cell phones,
we
right?
need our cell
I
phones,
do notice that, you know, I try to read my phone up this way now because I can feel all of this going down like this. So.
Correct.
Dr. Chaffoo, thank you.
Sure,
I'll think about that sometime today when I'm on my phone for 400 hours. 9:39 in the morning. Still ahead on Fox 5. Meet the comedian.